So we start again part 4 basically. So let me first bring my pen and then we start. Okay, Fundus, Fluorescein, Angiography. So part 4. In this part 4 we are going to discuss about the phenomenon of FFA. Basically there are three phenomena we are going to discuss about it, and the one thing that I have already told you, the difference between FFA and ICG, basically indocyanine green angiography. Which what do we mean by that, indocyanine green? So basically ICG FFA excellent method for demonstrating retinal circulation, but not helpful when dealing with the choroidal circulation. Why? Because of the choroidal capillaries are too much fenestrated, and basically fluorescein is get out from that fenestration very easily. So ICG is a particular value in studying choroidal circulations and can be useful adjacent to the fluorescein investigation to the macular disease, especially if it is very helpful if there is FFA and ICG, both reports are there. But yes, definitely it is very helpful in studying choroidal circulation basically. So I have taken just one slide. What is the difference between this? The dye used in FFA is definitely sodium fluorescein. Dye used in ICG is basically indocyanine green. Light use in FFA is visible spectrum, but in ICG is infrared. The purpose is to study retinal vasculature, and ICG is to choroidal vasculature. Filter use is blue-green in infrared filters. So expense is definitely FFA is lower and ICG is high. These are the gross differences that I want to discuss with you. Sometimes you see these terms and you don't know, so that's one slide. It's far better. So now let me come to the main topic, that is phenomenon of FFK. So all the processes occur in hyperfluorescence or hyperfluorescence can be described in three phenomena, and that's basically optical phenomenon, mechanical phenomenon, and dynamic phenomenon. So these all things, hyperfluorescence and hyperfluorescence, can be explained in these three terms. Okay, three phenomena. So let me describe first the optical phenomenon. So, what is optical phenomenon? Is non-neurosensory retinal is transparent. Basic means, so normal neurosensory retina is transparent, and RP in brush membrane are semi-transparent. So, these two things work as a something that hides the beneath thing, that is choroidal circulation, isn't it? Because RP and brush membrane is a semi-transparent. So, hence we can see the choroidal fluorescence. But if this transparency is pathologically increased or decreased, then what will it? Then we have window defect. At the same time, we have blocked, isn't it? Because if RP and Bruce membrane work as a blockage, then we have block defect. If RP and Bruce membrane is more transparent, then we have window defect, isn't it? So that's the, if decreasing transparency, so basically means blocked the fluorescence, isn't it? So, so we do see the choroidal fluor. So basically, choroidal fluorescence is cannot be seen, isn't it? So basically, accumulation of blood in the retina, which means it blocks the basically choroidal fluorescence, isn't it? If there is a block, blood is accumulated. So basically, this, isn't it? So hemorrhages will block the fluorescence, and this RPA hypertrophy will block the fluorescence from the choroid, isn't it? So choroidal nevus will block basically fluorescence. So increased transparency, if RPE becomes more transparent, yes, RPE improves membrane, then what happens? Then staining due to the drusen's and goid strokes, scars, and degenerative process will cause what? Basically accumulation of drusen's in our under RPE, or see this case, if there is drusen's, then you can see fluorescence. Another phenomenon is mechanical phenomenon. What do you mean by mechanical phenomenon? Is related to the adhesion of RP to bruch membrane. So RP formally attached to the bruch membranes by the hemidesmosomes, which creates basically blood, isn't it? Barriers as a function of barrier. So absence of hemidesmosomes, so RP is split away from the bruch membrane, and fluorescent stain fluid accumulation between them and pigment epithelium is detached. So that particular process, that is called, isn't it, pigment epithelium detachment? At that particular case, can you see this? Fluorescing is pooling of the fluorescent. So, and another thing is dynamic phenomenon. What do you mean by dynamic phenomenon? So basically, dynamic phenomenon is related to the diffusion of fluorescein within the tissue and determined by the inner and outer retinal blood barrier. So basically, diffusion of barrier. If barrier is not there, then what happens? It's a dynamic phenomenon because it's basically fluorescein is diffused, isn't it? Through the blood vessels. That's the concept. So retinal blood vessels, in normal blood vessels, do not leak out because of the inner retinal uh, blood barrier due to the zona occludens between the endothelial cells. And the zona occludens open up during the inflammatory process, obviously. And then what happens? This is normal, but whenever zona occludens becomes very endothelial cell lost, what happens? Then pores and then all the fluorescein get out inside, isn't it? So can you see this perivascularitis? This is the blood vessels, and blood vessels are basically inflamed, and just outside of blood vessels all the fluorescence are leaked, isn't it? So diabetic aneurysm, whenever there is aneurysm and see this aneurysm, white dot, basically fluorescent leak out, isn't it? So proliferated retinal vessels, all blood vessels are and even new blood vessels are also proliferated. So retinal pigmented epithelium, normal RP is tight, but zona occludens seal the portion of all the intracellular space of the pigmented epithelium monolayer. Then what happens? If it breaks, then definitely that's the connection of this. If it breaks, then definitely it's going to central serous retinopathy. So it's very important, isn't it? Small dot and it becomes larger, and larger means what? Means definitely it means smokestack pattern, isn't it? So another is hemorrhagic PED, wet AMD. In this particular case, can you see this fluorescent pattern becoming strong, isn't it? Dull, strong, and even stronger, clear pattern. So we have come to the last slide. That's my reference of FFA, and we're finishing with FFA. Okay, fine. These are the three good books that I can recommend you. Okay, Bistan, cheers.